The Elliot Health System is committed to delivering the highest possible quality patient care. And we expect to do this in an environment of open communication, where all members of the care team involved in a patient's procedure communicate effectively. This includes the performing surgeon, the anesthesia provider, nursing, and technical support. In fact, this is what our patients expect of us. They expect that we will engage, address all concerns, and answer all questions to ensure their best possible outcome. The Team Steps approach you're about to see in this video was constructed by your peers, and it serves to create a process that engages all members of the care team maximally so that they can contribute effectively, and also puts in hard stops that effectively eliminate possibilities for error. At the core of this delivery model is open, timely, and clear communication amongst professionals. This is the standard for the Elliot Health System.
All right, is everybody ready to do a timeout?
Yes. Okay.
All right, let's introduce ourselves. I'm Dr. Clock. I'll be doing the procedure.
I'm Jill. I'm the circulating nurse.
I'm Dave, CRNA.
And I'm Kathy. I'm the scrub.
All right, and today we have Mary Smith. Her date of birth is 7/6/76, and her medical record number is 111111. And we're going to do a laparoscopic cholecystectomy for chronic cholecystitis. Can you confirm that?
I can. Her wristband says everything, and the consent I confirmed over an SDC.
All right, does she have any allergies?
She does the sulfa drugs.
I'm not anticipating need for blood products and for DVT prophylaxis.
Sequentials are on and going.
All right, there's no images that we'll need. Dave, can you confirm we gave antibiotics?
Yeah, she's got the great data.
Are there any other special anesthesia concerns?
No.
And Kathy, we'll use the standard equipment.
Okay. All set, and I do have 0.5% Marcaine with FE on the field. I have 30 available.
Okay, thank you. Are there any other special needs or concerns?
She does have a rod in her right leg, so we'll make sure she's positioned right and grounded on the other side.
All right, if anybody sees anything you think is unsafe, I expect you to speak up. Call hard stop if necessary. Is everyone ready?
We're ready.
All set.
Thank you.
Thank you.
All right, let's begin the sign out. Jill, are the counts correct?
Counts are correct.
There's no images to record. The procedure we did today was a laparoscopic cholecystectomy. The post-operative diagnosis is the same: chronic cholecystitis and symptomatic cholelithiasis. The EBL was minimal. We used 30 of Marcaine,
Yes.
and the specimen will be gallbladder for permanent pathology. Let's do a debriefing. Kathy, how did things go?
I thought things went well. We had all the equipment we needed. We did have an issue with one pair of scissors that was pretty dull, so I'll be sure I tag that and send it down to sterile processing so it'll get sharpened.
Jill, how did everything go?
I think it went very well, and communication was good, and the timeout was great.
Dave?
Everything went smooth on my part.
All right, I don't have any other special concerns. I thought everything went very well. Thank you all for helping today.
Okay. Thank you very
Thank you.
much.
I really believe in the timeout process. I think it's very helpful for our patients to have the staff aligned and of the same mind, and I would encourage everybody to do it for every patient every time.
My name's Eric. I'll be the circulating nurse taking care of you this afternoon. There's a few safety steps that we take before we get started. When Dr. Fear comes in, we're going to do what we call a timeout. It's a national safety initiative, not just here at the Elliot, but we want to make sure we have the right patient on the table, the right procedure, all the equipment. Right now, we're just going to do a quick sign-in. So we're going to ask you your name and date of birth, and I'm going to verify with your ID band here. Can you tell me who you are
Kristen Jacobs,
and your date of birth?
7/4/1977.
Okay, when Dr. Fear comes in, we're going to do something similar to that. He's going to ask you some of the same questions, okay?
Okay, thank you.
Great.
Are we all set to begin?
Okay.
Do you have any questions?
No?
Okay.
Sign in complete.
Good morning.
Good morning.
Good doc.
Good morning, guys.
Good morning.
Hey there, how are you?
Hi, good morning, good.
Nice to see you. How have you been doing?
Very good.
Did you have a good weekend?
I did?
Good. Any chest pain at all?
No, I've had no chest pain.
Great. Okay, so we're going to get started, and we're going to have a quick timeout where we're going to talk about you, just to make sure that we're all on the same page together. If we say anything that's not true or we're making up any stories about you, just let us know, okay? And then we'll get you nice and relaxed and start, okay?
Okay.
All right, we'll just start in a minute. All right, everyone ready for timeout?
Yes.
Okay. Let's introduce ourselves since we have a visitor here. I'm Carl, I'm the cardiologist.
I'm Lenore, be on the monitor, nurse.
Brian, scrub tech.
My name's Eric, I'll be the circulating nurse.
And I'm Nancy, student nurse.
All right, so this is Miss Jacobs. Date of birth is 7/4/77. She is a woman with a history of right coronary stent about 8 months ago. She's had some recurrent chest discomfort. And so we've got a stress test, which was abnormal. We're going to do a left heart cath via right radial approach to see if the stent's still patent or there's new disease. And so Eric, can you confirm that we've had signed consent and that she is who she says she is?
Yes, confirmed.
And you signed the consent in the motion?
Yep, we did. Okay. Any allergies at all?
She is allergic to penicillin.
And what's your creatinine?
0.65 normal.
Great. Okay.
All other labs are normal.
Good. Brian, we have everything we need for radial access.
All equipment accounted for, and I have 100 mics and nitro on the table.
Okay, excellent. Okay, so anyone with any concerns, special needs, or patient red flags?
She told us this morning, Dr. Fear, she hasn't taken her Plavix in 3 days.
Okay. All right, so then if we go to intervention, let's think about a different antiplatelet agent for more quick onset of action then. Okay, we'll have to figure that out. Okay.
And where she just had a stress test, do you want to do an LV gram or are you going to just dip?
Well, let's see what happens after we get.
Okay.
Okay, then, so then if anyone sees anything you think is unsafe, I expect you to speak up. Call hard stop if necessary. Is everyone ready?
Ready?
Ready.
Okay. Everyone ready for a debrief?
Sure.
Yep.
All right, so why don't we start with you? Let's think about what went well, what did we do well, and what can we improve upon for next time.
Well, I have a question, Dr. Fear. You loaded her with Plavix at the end of the case. How many milligrams did you use?
600.
And if she had taken her Plavix in the last 3 days, what milligram?
Then just the regular 75 a day. She would have been already inhibited. Good question. Okay.
Thank you.
Eric, anything from you?
I don't think so. I think everything went pretty well from my circulating standpoint.
Okay. Right.
I think everything went well. We could have had that stent on board. But it seems we used it in the previous case. It was not here, and it was in the other room. So next time we'll get that involved.
All right.
I thought that there was great communication. I knew what was going on for documentation purposes and
Okay.
it went well.
I think it went well. Communication was great. It's nice to have a student here. I agree. I mean, you know, I know we just finished the case and you guys turned the room over fast, but if we use a product that we only have 1 or 2, let's make sure that we restock that before so that we don't have to run out. But otherwise, I think everything went well. Great, good case. How'd it go for you? Ms. Jacobs, did everything go well for you?
Yes, it did. Thank
You comfortable?
Yeah, everyone was fantastic. Thank you.
Great, okay. Thank you.
Thank you, sir.
Thank you.
I think the Team Steps program has really improved what we do here in the Cath lab. Before, we did a timeout that was pretty much by the book. No one really paid it much interest. It was just one of those things that we had to do to comply with regulations. Now, the Team Steps program has really taught us that the timeout is really valuable. We've no question seen that the members of the team in the Cath lab are much more engaged. They're much more empowered. Even students in the room feel that they have a role in the procedure and they add their information and they also ask questions, which is great for the whole team. So it's really improved the dynamic of the group and it's also improved patient care. We really know what we're doing, we're on the same page, and we're much more in sync with what we're doing, just from something as simple as the Team Steps process. In terms of the debrief, that's really been unexpectedly successful. I didn't anticipate that we would have so much really valuable information coming out of the debrief. It's interesting to really hear everyone's opinion about what went well and what didn't go well, and we've been able to pick up great bits of information that we've enacted, put into use really as soon as the next case that have improved patient care, and they've made real differences in what we've been able to provide to our patients.
Okay, is everybody all set? We'd like to do the timeout, if I can have everybody's attention, please. So I'd like to go through, and I'll introduce myself and ask everybody as we go around to introduce themselves and their role as we go through the timeout checklist. So I'm Dr. Mary Lee Soul. I am doing an ORIF of the right radius on Roxy Cameron. Her date of birth is 7/4/69. That's what's on the consent and
Confirmed on her name band.
and I do not expect that we'll have any specimens or cultures. The site is marked with my initials.
I'm Laura, I'm the circulator. Mrs. Cameron has no known drug allergies. She received Ansef, 1 gram at 12:35. Her SCDs are on and functioning. She is covered with lead and an x-ray collar. Her tourniquet is on and set at 250.
I'm Kathy Hunt, the anesthesiologist for this case. I confirm she has no allergies and she did get her antibiotic, and I have no anesthetic concerns. The only other thing I would like to add is that we be sure that we have all safety concerns taken care of. And as far as any concerns about fire, we have a fire extinguisher in the room. And do we have normal sailing on the field, Kim?
Yes, I do.
Thank you.
Thank you.
Hi, I'm Kim. I'm the scrub tech. For your case today, I have the Stryker distal radius set, as well as the Stryker drill system. Is that good?
Handheld or is it corded?
Handheld.
Perfect.
Great.
Do you have anything on the field?
No, I have no antibiotic or no local.
So Laura, if you could get Kim 10 mLs of 0.5% plain Marcaine so I can inject that as a local at the end of the field.
Okay, so I will prepare 0.5% Marcaine plain, 10 mLs for at the end of the case.
Perfect. Great.
I'm Brianna, I'm the x-ray tech. I'm confirming we're doing a right wrist. The patient is not pregnant. Everyone is wearing lead, and we have films on the view box.
Perfect. Okay, as always, if there's any problems or things that impact this patient's safety, please bring it to my attention. You can yell hard stop if you need to. Are we ready?
Yes. Ready.
Okay, let's go. Let's mark this.
Okay, counts are correct.
Okay, good. Why don't we spread our sign out now? Can you show me the sign out list? Okay, so we did an open reduction, internal fixation of the right wrist with bone grafting. Our EBL was probably less than 10 mLs because the tourniquet's still up, correct? I don't expect there to be any complications. We'll put the Marcaine in after we close. Laura, do you have the cast cart here for the splinting, please?
I do.
And you can have you know that she'll need a sling.
Okay.
I don't have any specimens. I'd like to start the debrief, and let's do it in the order of having Kim, then Laura, then Dr. Hunt, and myself. So Kim.
Well, I think the case went really well. It was really good that once you get in there, you realize that the fracture was a lot worse than you anticipated, and you asked for the bone chips. So we had those, got those in the room, so we had an allograft here on site, and we're able to use it.
Good. Very good.
I think everything went well. The communication was excellent. I think that working as a team, we were able to avoid any complications, and everything turned out well.
And the patient did fine as far as the anesthesia goes. She did very well, and I'd just like to thank Kim and Laura. I'm still relatively new here, and they do so much to help me get the case started, and I really appreciate it.
You're welcome.
So I think things went very well. I do want to commend Bree for making a quick entrance when we called her at the last minute to be able to come up with the x-ray, so that was very well. I feel like we did a good job here in terms of keeping the patient safe and communicating very effectively. Thank you very much. I hope you enjoyed our video about team steps and got out of it as much as I did from this in the safety initiative that the Elliot Hospital is putting forth. I was a little bit of a critic when it first came out, but I've come to really embrace the process because this is something that makes it very easy for everybody to be on the same team to take care of the patient for the ultimate goal, which is to have a safe outcome. I've practiced medicine all my life thinking about what it would be like if I was the patient or this was my family member. And this process makes me feel very comfortable that we produce the absolute best and safest outcome for all of our patients. It allows all of the members who help me to provide care for the patient to be on the same page and look out for the patient's safety. It's very easy to do. Even after just a few weeks, we have very comfortable run-throughs. It does not take very much time, and I think it's also very important for the physician to be the one who leads the charge. So please join me and the rest of the Elliot Hospital team in engaging with Team Steps. It's a great process. Our team loves it. Our patients have great outcomes, and I think you'll find it easy and affirming, something that you should embrace as I have.